All right, thanks so much. Well, we're continuing to support breast cancer awareness and Breast Cancer Awareness Month this month.
And what better way to support it than to learn even more about the disease? Joining us this morning to continue our breast cancer series with treatment options today is board-certified surgeon Dr. Garrett Peel with the Previty Clinic. Dr. Peel,
good morning.
Good morning.
Great to be here.
Well, this is something that that is front of mind this month, obviously, with Breast Cancer Awareness Month, but we want people to be aware of everything, especially everything that's happened over the years, because the advances have just been unbelievable.
Yeah.
What have you noticed?
And we have all of those innovations right here in Beaumont.
Absolutely.
So, the thought is that 1 in 8 women will be diagnosed with breast cancer, but not 1 in 8 women will die of breast cancer. In fact, the mortality of breast cancer is at an all-time low.
That is wonderful.
For 2 reasons.
Yeah.
One, because we are encouraging women to have
early
more
detection.
early detection
Absolutely.
mammograms, encouraging women to get their mammograms every year after the age of 40. It saves lives because we're able to find a very small breast cancer and then provide them with an innovative surgical approach. Surgery is the cure usually for breast cancer.
Right.
And then that's followed with chemotherapy, hormonal therapy, and radiation therapy. Some of the advances have been what we call breast conservation therapy, where we don't have to do a full mastectomy anymore for many women, especially those with early stage breast cancer. We can go in and actually remove the small stage 1 breast cancer, check the lymph node with sentinel lymph node technology, and then follow up with some radiation to prevent recurrence through a small catheter that only lasts 5 days, as opposed to 8 weeks.
Yeah.
So we're not only saving the breast tissue, but we're also cutting the time of treatment to only a few weeks.
Next to nothing.
Next
So
to
they can
nothing.
get right back to their lives.
And that's great because these women who are school teachers and involved in their communities and have families can actually have that security that breast cancer, one, if caught early, we can save their life.
Absolutely.
With the treatment modalities. So we've also had advances in trying to identify those women who are at higher risk, those women who have what we call the BRCA gene or the breast cancer gene, and there are 2 genes, 1 and 2. And by identifying women who essentially have this gene, we're able to potentially prevent cancer and other cancers such as ovarian cancer by offering them a preventive surgery up front. And in the preventive surgery, also available to some women with certain breast cancers, we offer a revolutionary mastectomy called a skin nipple areolar sparing mastectomy. This is a revolutionary approach to the traditional mastectomy. The old mastectomy was just to remove everything. All the skin, all the nipple, leaving the woman with a flat chest. The skin nipple approach, or the SNASM, is where a team of surgeons, an oncological surgeon like myself and a plastic surgeon or a reconstructive surgeon work together in the same operating room where we're able to, through a very small incision, remove all of the breast tissue and then do an immediate reconstruction for a wonderful symmetrical cosmesis.
And you were talking about these women that you know are more at risk. Have you had any interest after the whole Angelina Jolie thing of people coming in and saying, I want to know if I'm at risk and should I do something like this early on?
Absolutely. We found that a lot of women want to know if they are at risk of breast cancer. They want to know their lifetime risk
Before
at least.
they get the disease.
Before they get the disease, so that they could potentially have a preventive surgery. And so we use certain models to calculate that number. We can actually identify all of your risk factors, look at your family lines on your mom and your dad's side, and then give you a percentage. Okay, your lifetime risk is this, your 10-year risk is this, so that the woman can be very educated about what treatment options are available and potentially stop this in its track. But what really makes the difference is early detection mammography. Those mammograms save lives.
And you don't feel sick oftentimes. That's the thing, people say, I feel fine, I'm good. But the early detection, you probably wouldn't feel fine. I mean, you wouldn't feel anything different.
Right, exactly. Also, self-breast exams. Women need to know their breasts. I tell my patients, pick a day, it's your birthday. Every month, on that day, do a breast examination. and get to know your own body so that if it changes, you can get right to the doctor.
And that can actually start at a pretty young age.
Absolutely,
Yeah.
and actually our pediatricians start educating our young women about their bodies and their breasts,
Absolutely.
and it's just crucial.
What a great peace of mind knowing that we've advanced so much, and there's not only ways to save lives, but to save breasts as well. It's just got to be just a wonderful peace of mind for people.
And to
that
save
have do
time.
this. Yeah,
and
sure.
to save time, which is remarkable.
Yeah.
Right here in Beaumont, Texas.
Yeah.
Don't you love it? I love it.
It's a blessing.
And I mean, what a rewarding thing to see these women come into you scared that they could lose their lives and then walk out feeling, hey, it's going to be okay.
Absolutely.
Right?
The most fulfilling part of my job.
Most
Yeah,
definitely.
Imagine.
Well, don't forget, it is Breast Cancer Awareness Month, but it's something, as Dr. Peel said, do your self-exams once a month, at least on maybe on the day of your birthday, on that date. Do that every month, and just mammograms, early detection, all of that. So
Think pink all month, all year.
all year.
All year.
I like that. Dr. Peel, good to see you. Thank
Good
you
to
so
see you.
much. Coming up, Jeff Gerber with another check of our Wednesday forecast.
It's 7:46.